We have 5 amazing and accomplished women here today to share their story and be a source of inspiration to other women in healthcare. So Sonia, welcome. And do you mind just giving us a quick just overview of what Me Mentor is before kicking off the panel?
Yeah, absolutely. I'm so thankful to be here and be able to present and show you all what Me Mentor is all about. We are the next generation of healthcare leaders, and what our whole goal and purpose is to make sure that traditional, non-traditional, BIPOC, and others as well can be aligned and have a mentor to be able to help facilitate and, matriculate onto whatever healthcare professional program that you desire to enter into. We have over 12,000 members within our Me Mentor profile network, and 2 of our panelists that you'll hear from today have gone through the process and have been accepted into medical school, and all due to our possibility because of Me Mentor. So I'm so excited and happy and thrilled to be here and to be present this morning. So thank you all for having me. And our first panelist that I'd like to introduce is Dr. Rosario.
Hi, everybody. Can you see and can you hear me?
Yes.
Hi. So my name is Miti Del Rosario, and I'm actually a first-year resident here at UCSF. I'm actually at work right now, so I apologize. I'm going to be here for a bit and then going to pop out. But yeah, I'm a first-year resident at UCSF in their internal medicine program with the San Francisco primary care track. I had a pretty non-traditional journey into medicine. I was undocumented prior to starting medical school, and it was actually really challenging for me to figure out how to navigate that because I just hadn't met anybody else who, was also undocumented, was also trying to get into medical school. It took a while for me to find mentors. And actually, one of my mentors, Dr. Loaiza, is one of the people who is part of Mi Mentor, and so was very fortunate to meet a lot of people who were able to help me figure out how to best be prepared for medical school. Things that made my journey non-traditional. One, I took 10 years of gap in between undergrad and medical school. During that time, I struggled as an undergrad. I was an undergrad at UCLA, and I really struggled with my grades. I think I graduated with, I want to say, a 3.2 GPA. And so had to figure out how to, study better, improve my skills, and was able to do about 2 years of post-baccalaureate classes through UCLA Extension. And that was how I was able to help with bringing up my GPA. I had to take the MCAT twice. And again, in that 10-year gap, part of it was that I, didn't know how to apply as an undocumented student. And I waited until I had DACA status to apply. And did a lot of my time, working with programs like Pre-Health Dreamers, MedPep at UCLA, Mi Mentor, as like ways for me to, one, help myself, like learn how to be a better applicant, but also to work with other students who are trying to navigate that process and also mentor people and be an advocate for our communities. Anyway, couple of years ago, I was able to get into UCLA for medical school, and now I'm very happy here at UCSF. The plans of eventually going back to LA, and I can't believe it. It's like 3 weeks from me finishing up my intern year, and it's been a tough year, but I am still very happy to be able to do what I do for my patients. And yeah, I don't know. I'm in a good place right now, even with the dark circles you're seeing under my eyes.
Same. No worries.
But thank you. Is there, if anybody wants to connect with me, I'm also very happy to leave my contact information. And you're all welcome to reach out. I get busy sometimes, so sometimes it takes me a while, but I always love to hear from students and love to connect you guys with other people who can help you. So very, very grateful for programs like Mi Mentor for getting me to where I am.
Thank you so much, Dr. Rosario. It's a pleasure to hear from you, and thank you for sharing your story and showing us how far you've come into your journey, especially as a women physician leader and a BIPOC leader. within our communities. And so it's awesome to see that you're at UCSF. So thank you again for joining us. I know you have to hop off, so thank you. We appreciate you. Our next speaker that we're going to have is Dr. Erica Webb.
Hi, Sonia.
Hi, Dr. Erica Webb.
Hello. Hi, everyone. I'm sorry. I'm in my car now. I just moved from Los Angeles to the East Coast. My residency is going to start in June here at Bridgeport, Yale, Connecticut hospital. So I'm in the midst of actually transitioning from medical school to residency. So you guys actually get to see the chaos finishing school and then trying to transition here. But a little bit about myself. So I'm from Los Angeles, California. I'm the first of my family to graduate medical school and become a doctor. And so with that came a journey that was kind of challenging, I would say. I had Dr. Montez, who's a part of the Me Mentor, as my pediatrician from when I was a very little girl, who turned into a mentor and very good friend of mine. And she helped me in her ways to navigate becoming a physician. But again, I didn't really have a blueprint or know really how to go from becoming a pre-med to applying to medical school. So I was non-traditional as well. And, being non-traditional, my degree was in community health and healthcare management. And then I went on to get my master's of public health, but I had to stay a while in undergrad, an extra 2 years to do the pre-med requirements to get into medical school. So with that came its challenges too, because, I didn't have a degree in biology or, organic chemistry or biochemistry. So I didn't look like the traditional student. And then I did okay on the MCAT, but when it came down to, applying, the financial burden of applying to medical school and having to be, a secondary application and then, flying out to different places to interview, that costs a lot of money. So I went on ahead and decided to go to the Caribbean for medical school. I went to Saba University School of Medicine, which is on a small island. And I chose Saba because the tuition in itself wasn't as bad as the other Caribbean medical schools, but also it was a small knit community. And I knew that I can have mentors there or faculty members there to really help me, because being non-traditional and not really knowing how to study medicine can be rather difficult. I would say the first semester I struggled. And so I became an international medical grad. And not only that, I'm an African American woman. So you didn't see a lot of African American doctors along the journey for me. I knew a few, but they were kind of much older and already in their practice, and things have changed. So it was a little difficult for me to feel like I belonged. We call it the imposter syndrome. And even though I wanted it as bad as I did, I've always wanted to be a doctor since I was like 5 years old, but I did not know if I fit the identity of a physician because of how I looked. And so that was something that I struggled with along the way. But I learned through my journey and, with Dr. Montez and Me Mentor, that there is no one specific look of a physician, right? So it doesn't matter if you're African American, doesn't matter if you're Latino or Latina, doesn't matter if you're Chinese, Japanese, Vietnamese, if you're Indian, Sri Lankan, it doesn't matter. You could be a male, female, non-binary, you are still a physician. If you really want it badly, you can become a physician. So it took a while for me to gather up that confidence. There was many nights I spent crying to my mom on the phone, really thinking if this was for me or if I should quit and try something easier. And, my mom has always been in my corner to, help me and reorient me to focus on the dream. And so, when it came down to it, I applied for residency in the middle of a pandemic. And so, a lot of these interviews that we were doing were all on Zoom. And so I'm pretty great with speaking to people, especially in person. I'm definitely a people's person, but now I'm behind a computer screen. I have a camera, and I'm like, how am I going to get these people to see how genuine I am about, practicing in these communities, like in the Black community, the Latino community? How am I going to show them, yeah, I'm African American woman, but this is my passion here? And so it was really difficult, but I was able to get through the interview season on Zoom, which saved me a lot of money, which was great because I don't come from a lot of money. And I was able to obtain my first choice hospital residency program. And so I ended up doing, I would say, much more than okay. I got my own, the choice that I wanted. And I'm on the road now, here moving, and it's very surreal. And being the first of the family to do it now has helped me to open doors for other women in my family and women that look like me and women of color, so that when they see me in those white coats and the stethoscope and they see it, I did it, you can definitely do it too, So I'm just really happy to be here, and I love mentoring pre-meds. I usually do it at Kaiser Permanente, Hippocrates Circle. We usually have, I believe, middle school students that we mentor and try and get them on this path. So I would definitely love to, if anybody wants my information, I'll definitely get to Sonia. You can text me or email me, and I would love to, pay it forward, because that's what I'm all about. I wouldn't be here if I didn't have someone like Dr. Montez paying it forward to help me through, and me mentor to help me through. So,
Absolutely.
Yes.
Thank you, Dr. Webb.
Thank you.
I appreciate
Thank
you
you
for
Sonia.
coming here and being here. So
Of
thank
course.
you. All right. So our next speaker that we're going to have Dr. Contreras.
Hello, good morning, everyone.
Good morning, Dr. Contreras.
Thank you so much for having me on today. I'm so excited to speak to all of you. Again, my name is Dr. Veronica Contreras. I am a family medicine physician, urgent care physician here at Premed. I am also a telemedicine physician through Rodox, and I have a few businesses on the side. So I just want to talk to you about my journey into the path of becoming a physician. I am also non-traditional. My parents immigrated here from Ecuador. They actually came here illegally. My mom was pregnant with me at the time, and she was the only female in the group of about 20 men. Thankfully, they got here safely. I was born in LA, grew up in LA until we moved a little bit further east. I went to undergrad at UC Irvine, where I majored in both biology and in Spanish. And I think one of the common themes that you're going to see with many of the panelists is that a lot of us were either the first one in our family to go to college. We didn't really have that much guidance. Good thing now that we do have Mi Mentor and other organizations that will help students like us who did not know the process of becoming a physician, didn't know even from college how to fill out a FAFSA, what to do right in our personal statements, how to fill out applications. It was all a learning process for many of us because we didn't have anyone to guide us. We didn't have anyone that we could go to, our parent or a family member, and be like, how do you do this? And so it was really difficult, even from the get-go, trying to get into undergrad. So I did graduate from UC Irvine. There, it was a struggle. I didn't do very well in some of my classes. I think I took calculus like 3 times, had to repeat classes, take summer school to make up, so that I wouldn't fall behind. And many of us who were in undergrad were told, don't even bother applying to medical school. You're not going to get in with your grades. You're going to waste your money. It's pointless. But we all continued looking forward, trying to find people that looked like us, that could guide us, that were in similar situations as us. And so we just ignored all those people that thought that we wouldn't be able to make it. And at that time, even through elementary, college, I was an introvert. So I kind of tried to figure out everything for myself, didn't really look for people to guide me. As I got into college and as the years went by, I started asking more questions. And I took the MCAT 3 times. The first time I applied to med school, my grades were the best, and my MCAT score was not the best. I would have to, like I said, I repeated the MCAT 3 times. And at that point, I thought the best thing would be to take more classes so that I would improve my GPA. And so I did an unofficial post-bac at Cal State Fullerton where I took more classes to improve my GPA. I did have the research, I did have volunteer work, but I needed that extra, the grades to improve and my MCAT score to improve so that I could be a good applicant. While at Cal State Fullerton, one of the counselors introduced me to osteopathic medical schools, which I had not heard anything about in undergrad. And I was thankful to him because otherwise I would not have gotten into med school probably. At the osteopathic medical school where I got into was Western in Pomona. And they really looked at the application at the applicant as a whole, as, they wanted a well-rounded person. And I really enjoyed the whole concept of seeing the patient, as a whole, the holistic approach to medicine. And so I got into Western. Out of 186 students that graduated, there were only 4 Latinx students in our class. Mm-hmm. And so it was still a struggle during medical school. And then I eventually applied to residency at Riverside County. And again, there was not very many Latinx residents in our program. So with all of this, I'm sure you could see the theme, like many of us were first generation, many of us did not have that guidance. With Mi Mentor, there are so many students that are now being guided because if you don't know, there's only 5.8% Latinx physicians, now. We need more physicians of color. Because we're the ones that are going back to our communities and treating our people. And so we speak the language. The patients can trust us and they come to us. They're so excited to see us, when in residency, I talk to the patients in Spanish and they're like so surprised and they're so happy because there's someone that actually looks like them and that speaks their language. And so it's just a blessing to be a physician. And even though the path is hard, sometimes we doubt ourselves. The imposter syndrome is real. Even now I'm like, oh my gosh, I can't believe I'm a physician. And so it's just a blessing, and many of us are here to help you out as much as possible. Don't surround yourself with individuals that think like you, that are positive, that will help you out. Reach out to people like mentors and other physicians and anyone at your school, and ask lots of questions, make lots of connections. I know it's hard, especially if you're an introvert and shy, but we're just here to help you. We know exactly what you're going through, and we want you to be a physician. We want you to go through this journey and then go back and talk to students like this. And so I'm just very blessed, and thank you so much for having me on. And hopefully if anyone is interested in family medicine or my path or anything like that, feel free to reach out to me. I will give my email address and hopefully, I can guide you along the way. And like I said, there's many of us here to help you out.
Thank you so much, Dr. Contreras. It's such a pleasure to have you, and thank you for being a part of Mi Mentor.
Thank you.
All right. And our next speaker is Dr. Chen.
Hello. Can everyone hear me? I think they can.
Hey, Dr. Chen.
Okay. Excellent. Good morning, everyone. My name is Viviana Wang Chen. I'm a family physician. Currently, I'm working with Altamed, which is one of our largest FQHCs, federally qualified health centers here in LA, Orange County. My journey to medicine didn't actually start till much later. So we talk about how we really didn't know where we wanted to be in 10 years, right? A lot of times we actually never really are presented the opportunities until much later. My family immigrated from China to Mexico, and that's where I was born and raised, along with my brother, my younger brother. And throughout our kind of childhood, it was really about what's next tomorrow, right? It wasn't about what's going to happen in 10 years, what we're going to be. I didn't actually see a doctor until the first time I was sick in college. So my family, they were blessed enough to be able to be sponsored and immigrate to the US so that my dad could keep working in a Chinese restaurant. So for them, every day was about working really hard for us, their children. And for me, it was about working really hard in school to pay them back, right? And ever since I can remember, it wasn't like I found someone that I called a mentor, right? I actually found a lot of friends who were ahead of me in the year above, who just did well and they wanted to do better. But for me, it's like I didn't actually call them my mentors back then because I didn't know that word existed. Now that I look back, I really think that the people that are 1 year ahead or they're a few years ahead, they were actually my first mentors because they told me, look, you got to do well in this class, take this class next, and then you can apply to college. And sure enough, I just kept doing that. What's today's class? What's today's homework? Do it, do well, and then move forward. And thankfully, I was able to get into four-year college, dictated by pretty much my mom at that time because she looked at the back of a Chinese phone book and it said the number one public, school at that time was UC Berkeley. And I think you should go there, daughter. So I did. I went to UC Berkeley and it was such a big shock for me because everyone you saw was a valedictorian, a salutatorian. They were just the top of their classes. And that's where I realized that I was a really small fish in this big pond, right? I was swimming with a lot of big fishes and I just felt really inadequate. And for me, what made me really stay the path of like, okay, day to day, I'm doing this for my family. I want to make them proud, was just to see how hard my parents worked every night. And so, I started noticing that my grades weren't doing, pretty good compared to others. I got my first C, I got my first C minus, and I really thought, wow, like, so what am I going to do? I was at the time, really enjoying my Spanish classes. And so I actually decided at that time I wanted to be a bilingual science teacher. And then I realized I want to also translate for people and interpret in the courts. And I was kind of like on that journey when I also met a lot of other people who were on this pre-med track and they were ahead of me, right? So then I talked to them, right? Again, another form of mentorship. And then they told me, there's this great community of peers and mentors called BSP, Biology Scholars Program. You should join. And, I remember interviewing, right? And it was such a pleasant experience that I did not expect because it was more about, let us get to know you, Viviana, and let us get to know how we can support you. And that's where I actually met my first pediatrician at the age of like 19, 20, Dr. Karen Soco Gutierrez. And she was actually one of my first, doctor mentors. And she said, hey, come with me to El Salvador. We're doing this project, Children's Oral Health Project. And that really started inspiring me to do more in terms of the medical field. And so I finally declared a double major and I decided to do Spanish and then molecular cell biology, one of the hardest majors. And I think had I really had much better guidance, I probably would have just stuck with Spanish, linguistics and bilingual issues, and then move forward with that because it's really about what do you enjoy, right? Not what other people tell you to do. So, long story short, I did have to, move forward to do a post-baccalaureate program. And at the time, I remember one of my mentors saying to me, Viviana, I know you didn't do well in undergrad and your sciences really sucked, right? But everything else, right? Your extracurricular activities, you have great letters, you're going to do fine, but you need to really invest the time in showing that you can do the work, right? So at that time, his quote was, there's no post-bac to a post-bac. So make sure you do this right. And so I completed the 1-year post-baccalaureate program at UC Davis. And during that summer before I actually decided to do a post-bac, I remember going to this UC Davis conference, and I met one of the deans, and I told them, I'm a pre-med. I really want to go to medical school because of my family struggles with healthcare access. And I wanted to be the person to really be there for them, to be for my family members, to be for friends, right? And he told me, you seem like a nice lady. If you like to cut, may I suggest podiatry? Now, if you want to keep your hands, not dirty and clean, maybe I suggest optometry to you. And that was such a painful experience, because I had told him, I think I want to be a doctor. Yet that discouraging statement, I went home and I almost cried, and I didn't cry, but I almost cried. But that really ignited my fire to really push forward, because there's going to be those people who are going to tell you no. There's going to be the people that are going to tell you, you should do something else. But until you really fail and you know that you've given it your all, right? I think you need to find someone that really trusts you, right? And you trust them, and they're willing to tell you the truth, right? The truth about your grades suck. Stay 1 more year, do this, and then once you have a nice little package wrapped up for a community to see, right? That community will see you have deficiencies, but you're going to do better because you have these experiences. So
Yes.
I found people that really believed in me, and they said to me, Viviana, you need to do the post-bac, and I did, right? And thankfully, it only really took that 1 year in post-bac, wait a year, right, and apply. And I got into multiple medical schools, but I decided to go to UCLA to the Prime program in medical education with leadership. And I also ended up doing a master's in public policy, something that I did not expect to do, because I just knew, hey, public health, that's what I see. My mentors are in public health. But along the lines, I realized that for us in medicine to really change something, you need to actually talk the talk, right? How do policymakers think? What do we need to do to get their attention? And so I said, Viviana doesn't know much about policy. Viviana's going to learn more, right? And that's how I ended up in health policy at UCLA. And it's something that I definitely do not regret, because I had similar, passions as a lot of these, public health and masters in public policy students, but we just kind of diverge in where we want to end up. And so, I moved forward to staying in Southern California, LA, sunny weather. So I decided to go to our Kaiser Family Medicine program in Los Angeles. And that really, gave me the tools to really be a good doctor. But now after that, it was, okay, what's next? Where do I want to work, right? And I really, started going back to the mentors that I met back 10, 11 years ago, back in UCLA, back in UC Berkeley. And you guys, many of you know Marco Angulo, and he said, Viviana, come over to Altamed, right? We're doing great things here. And that's where I'm at. I feel like, this journey, the things I wrote in my personal statement for medical school, for post-bac, for residency, I said I wanted to go back to our communities that lack the access, the quality care, and that's what I'm doing now. I am being able to be pulled into different communities. I'm able to help out in so many different ways, and they need people like us, because they have a lot of people that say, I want to go back to the community, right? But so many of us don't have the chance to do it because we don't have mentors to tell us to do the right thing. So, find a couple of people to tell you the truth and what to do. And then really, time out your plan, right? Don't rush things. And you just want to do it once, do it right, do it twice, do it right. But really don't lose that faith, because there's going to be a lot of bumps in the road. There's going to be a lot of people who tell you no. But I think at the end of the day, if you find the people that tell you, yes, you can do it, you're going to be able to really succeed down the line. And success is measured in so many ways. So good luck to everyone. And we hope that you guys will reach out to us in the future. And we hope to be calling you colleagues.
Thank you so much, Dr. Wang Chen. I was just again, amazed at everything that you said. So thank you it's such a privilege to meet you and have you here. And so we have our next speaker, and these are my friends and my colleagues that I've met through Mi Mentor. If I can have next Mariela Magana. She is a rising MS1. And so I'm so happy to have you here, Mariela. Thank you for joining us and thank you for being present with us.
Hi, everyone. This is Mariela, as Sonia mentioned. I was, for this past year, the Chief Operations Officer for Mi Mentor. And like the other participants, I also have had a non-traditional pathway to medical school. I come from a farm working community. My parents have been farm workers since they immigrated to the eastern side of the Coachella Valley. So some of you might be familiar with the Coachella Fest or Palm Springs. But I grew up in the eastern side, which is where a lot of the farm workers, low-income families live. Similar to our previous panelists, right? I was salutatorian, went to UCLA, and I had that same challenge, right? Coming from a small town, going to a big university where everybody is the top of their class. And not being able to have good study skills. Unfortunately, I didn't perform well academically. I always say that my experience was like when a rookie soldier goes to war and you put the rookie soldier in the front line without armor. What's gonna happen? That rookie soldier is gonna die. And so that's essentially what I initially felt when I was at UCLA, right? Not being able to have the armor. And it wasn't until I was able to connect with the UCLA MedPed program and CESLAC that I was able to start meeting mentors that not only believed in me, but were also providing the knowledge and the skills needed to excel in college and then as a future pre-med student. So I was able to graduate from UCLA in 2014 with a biology major and a minor in Spanish. I don't think I asked the right questions, and even, you know, when I was given the advice, I always was like, no, I need to be a science major because you have to be a science major to go into med school. And, you know, in hindsight, like for all of you all listening, like you don't have to be a science major. Like I feel like if I would have the chance to do it again, I probably would be an anthropology major, a public health major. So definitely, you know, listen to your mentors and follow what your passions are. I think that's definitely something that I made sure I did after graduating UCLA. So I graduated UCLA with, I believe it was like a 2.6 BCPM GPA. So as you know, that's like a very low GPA to even be considered to applying to med school. So what I ended up doing is I ended up applying to the UC Consortium Postbac programs. Unfortunately, because of the low GPA, I wasn't competitive enough to even get into that postbac program. So I knew I had to do something different, right? And that was going to entail more perseverance and focus and my ability to really, you know, help build my network, because I wasn't going to be able to be part of a official postbac program. So what I ended up doing is I completed an unofficial postbac program through UCLA Extension. So through those years of completing the postbac program, I ended up working full-time. So through working full-time, I was able to kind of do things that I was passionate about, like policy advocacy, you know, building collaboratives and working in the HIV field as a data quality analyst. So while I did that from like 8 to 5, in the evenings, I was taking classes to the UCLA Extension. And again, that's expensive, right? Because it's all out of pocket. You have to pay the classes out front. There's no financial aid. So if you could definitely gain those skills early on and avoid doing a postbac, I think that's the best way. But again, I embrace my journey and I know that my worth. And so even if you have to do a postbac, like always remember that, you know, you are going to be a great doctor regardless of how long it's been taking you. So again, I took 22 classes through UCLA Extension. Unfortunately, because my BCPM was really low at one point, you know, you could take 50 classes, but it's not gonna like get really high, because at one point it's going to plateau, right? So I think that's something that for all of us that doing a post-bac, we have to keep in mind, that at one point you just have to trust the process, apply, and believe that you're going to get in. And you only need to get into one school. Right. And so through those 7 years, I was also part of other pre-med programs like Health Career Connections, Future Physician Leaders, and of course, Me Mentor, right? So these were essentially the organizations that kept me focused and really ignited my fire to continue. So similar to a previous panelist, seeing my parents work hard labor, manual labor as farm workers, and like the hot heat in the summer here in the Coachella Valley was my motivation to not give up. Because if they weren't giving up to wake up the next day tired to provide for us, I couldn't give up. Like, I just couldn't. Knowing that I had, one, their support, unconditional support, and the opportunities that this country provides to ensure that, we are able to get a higher education. So I was also introduced to osteopathic medicine. So when I applied to medical school this last cycle, I applied to both allopathic and osteopathic medical schools. So in total, I ended up applying to 31 schools. And why? Because my metrics were low, right? So I think when you apply to med school, making sure that you, are realistic with yourself, and you cast a wide net, especially when your metrics are low. So I ended up, thankfully, I ended up being accepted to a osteopathic medical school. So it's A.T. Still University at Arizona. And so they're very community medicine driven. And I'm just so excited that, I found a school that was able to embrace and really see the great applicant that I am, because I have so much experience, right, coming into medical school. And so, like many of the panelists, I want to go back to serving the farm working community. And so really, I really hope that you take from my journey, like the importance of keeping, feeding that passion and being tenacious, like don't giving up, because there is a school out there for you. And our community needs us. Yep. And I will also be sharing my email in case any of you all have any questions.
Thank you so much, Mariela. Thank you for coming here and joining us. And our last speaker, who I've been friends with already for 5, going on 6 years, is Griselda Aguilar, who is a rising MS1 at UC Davis School of Medicine. So thank you for being here, Gris.
Yes, thank you for having me, Sonia. Hi, everyone. My name is Griselda Aguilar, and I'm also non-traditional, first in my family to pursue a career in medicine. I actually grew up in the Salinas Valley, known as the salad bowl of the world here in California. My parents were immigrant farm workers from Mexico, and I actually moved to Mexico when I was 10 after living here for some time. The reason being that we had to care for my elderly grandparents in Mexico. And I always share this story because it's the reason that I am here today pursuing a career in medicine. After caring for my grandparents in Mexico, I witnessed how my diabetic grandmother strived that drinking a green cactus juice every morning would help cure her diabetes. So I became really intrigued by this, and I went to all her doctor appointments with my mom, and I helped check her blood pressure, her glucose and her blood pressure too, every day, and helped administer her medication. So I really came to see how important it is as future physicians to understand a patient's culture beliefs and their own understanding of their disease in order to come with the best care and plan for them. So after my experience with my grandmother, we returned, I was about 15, returned back to the US, and I was enrolled in 9th grade high school. And unfortunately, I was classified as a second language learner, English second language learner. And I knew that my remedial classes weren't going to allow me to enter college. So I knew from the beginning that I had to seek mentorship. So for me, it was the college assistant migrant program and the migrant education program for students coming from migrant backgrounds, farm working backgrounds. And they were really the ones who introduced me to Fresno State. And that was the only really college that I knew about and I attended. Like I said, I was first generation, and I attended Fresno State and was enrolled in their Health Careers Opportunity Program. And with that, I met the first Latina physician who looked like me, who shared a similar story as mine, and this was Doctora Kathy Flores, the founder of the HCOP program at Fresno State. So she was my first mentor in college, and she actually told me an opportunity about a summer program at UCLA called UCLA Pre-Medical Enrichment Program. And through UCLA, I met one of the founders of Mi Mentor, Dr. Efraín Talamantes, and also Dr. Margarita Loesa. When I first learned about Mi Mentor, I just was really amazed that there was so many Latino physicians out there that I didn't know exist, and they shared these similar stories of resilience, like we have heard from our previous panelists. So at that point, I knew that I was gonna make it if I just kept persevering, right, and kept asking for help whenever I came across any kind of obstacles. I remember it was about 2015, 2016 when we brought the first Mi Mentor Central Valley board to Fresno, and that's where I met Sonia, and we have now a full board there in the Central Valley. And once again, right, we're just doing all this work volunteer based because someone did that for us. So it's our way of paying it back, paying it forward. And this is actually the first year also that within our Mi Mentor in the Central Valley, we have about 4 of us going on to medical school. We're all first gen, and it was not easy at all. But again, we continue to seek that mentorship through Mi Mentor, through HCOP, through HCC. We're very resourceful as first gen, as you can see.
Yeah.
So Mi Mentor was really instrumental for my success in applying to medical school and gaining acceptance to my dream school, UC Davis School of Medicine. And I always say that, you have to hold on, right, like Mariela shared, to what inspires you. And similar to Mariela, for me, it was my family. They're all farm workers, and even through this pandemic, my mom kept working in the packing house and has so many loved ones, unfortunately, lose their lives because they were exposed during this pandemic because they were, of course, essential workers. And it's just a reminder that we are needed in our community, and we just have to continue finding those resources that are going to take us to the next step. So actually for me, as I was applying for medical school, I was reaching out to my Mi Mentor mentors who are now 4th-year medical students, applying for residency, and they were really the ones with mock interviews or giving me, the small tips that I needed to share my story in the most effective way. Because of course, as first gen, I know myself, I struggled because I may come off too humble, or I struggle to articulate myself, but of course, this is something that we can easily fix, right? As with practice and seeking those mentorships. So what I want to share with everyone listening out here is join Mi Mentor. We have our free downloadable app. It's called Mi Mentor, and follow us on Instagram, Twitter, all the social media platforms. We have many healthcare leaders out there, not just for pre-med, and you're really going to find that community that believes in you.
Yep.
It's going to give you the tools to take you to that next step, whether it's struggling with MCAT or needing extra practice for mock interviews, or you're unsure whether or not to do a post-bac program. Really, I strongly believe that the future is within our Mi Mentor community. We're really all there, really to at the end of the day, one day return to our underserved communities and give back in any way that we can. So thank you all for having me. I will also share my email. And thank you, Sonia, again for leading this.